Limpopo is leading South Africa's COVID-19 vaccination rollout in terms of doses administered to the province's adult population and its effective registration of elderly residents. Today, the province started their educators' vaccination rollout, and to tell us more on this, we're joined live by Limpopo Health MEC, Dr. Phophi Ramathuba. Dr. Ramathuba, thank you so much for your time. It certainly looks like you're well on your way then to achieving the target of reaching herd immunity by February 2021.
Evening to all your viewers out there, and thank you for inviting us. Yes, indeed, for us, if we are given a task to perform, we always put our best efforts. It's a teamwork. And we have a master plan for vaccinating. And that master plan, each time there are amendments at national, we always adjust our plans. And believe me, if we can have a sustainable supply of the vaccine, we can reach the herd immunity long before even February.
And you talk about a stable supply of vaccines. I know that this has been a challenge nationally. How bad has it been for the province of Limpopo?
I think on this one, we can't single out the province, Limpopo, or even the country, South Africa. You know, we've been having this serious challenge that the president of the country has been leading this campaign to make sure that we all get the vaccine. So you know that there's been a delay from AstraZeneca's challenges and J&J, and even now we are busy with Pfizer. So we are reassured by the fact that in the last family gathering addressed by the president, he reassured the nation that we will start to see the improvement in terms of the vaccine supply. For instance, in our province this week, we got 56,000 dosages, and we've been promised that next week we will be doubling the dosages. So we want to reassure you that once we double the dosage and triple the dosage that we are receiving, we are going to be activating our master plan. We believe that the current system that we're using, of using the 37 fixed sites that are hospital, we're doing it, one, because this is a new, it's unprecedented, this particular pandemic we're dealing with. Now, if vaccines themselves, you needed to utilize facilities where if there are adverse events that require resuscitation, your hospital environment can assist. So by now, we are familiar, we know the virus, we have got the vaccines, we know much about them. We will be decentralizing to our 481 clinics. So just to give you a numbers to say, if each clinic out of the 481 clinics in the province can have just 2 vaccinators, and our vaccinator, one vaccinates 50 people per day. So if there are 2, they will be vaccinating 100 people per day. So if you put it up to 481, you can see that within 4 months, we would have vaccinated the whole population that is required to be vaccinated in the province. So you just need to put up your plans. Because if you look at our work, if I'm to take you back to say, when you talk about our registration for the senior citizen, how do we achieve? Because as a province, because of our rurality, we don't even have network connectivity in our villages. Equally, the very same above 60 do not have the smart or Android phones. At the same time, they don't even understand the internet. So what we did as a province was to, when the minister on the 16th of April launched the self-registration, we went further and put a phase 2, where in the premier launch, what we call assisting registration. We were with the premier doing door-to-door, assisting senior citizens to register. On that day, more than 10,000 people were registered, something we couldn't achieve in a week since the minister launched. The game changer was when we had our community healthcare workers, 9,000 of those. We handed them the smartphones and data, and they were given targets to say, you go and vaccinate. They were doing door-to-door, where they found that there is no network connectivity. They will be able to collect the data manually. We design the forms and they will come and load it. So that is why you'll find, let's say, out of 9,000, if each can register 10, it's easy to reach target. So it's an issue of you understanding your material conditions on the ground and then plan according to that. And lastly, we knew that the vaccines will be easily accessible to those who are insured, to those who are in the urban areas, to those who are affluent, who can afford. We wanted to remove that and say the poorest of the poor, those who do not even have access to quality healthcare, let's for the first time as a country make sure they are the ones who get prioritized because they are vulnerable. Even if they get infected by the virus, they won't even have access to a ventilator. So that is why you see us as a province leading in terms of vaccinating the uninsured, those poorest of the poor, those of our grandparents who are in the deep rural village of Achikunda. So that's what we pride ourselves with as a province, to say we are reaching out to those that many cannot reach to.
And really, it sounds like, there's been a lot of progress that has then been made. But let's talk then about some of the sentiments on the ground. Vaccine hesitancy is a real thing. There are some concerns from others who are simply not, going to take the vaccine, or others opting not to because they're citing one concern over the other. What are some of the concerns that were raised to the healthcare workers on the ground, and how are you then navigating these waters?
Those sentiments were raised. We knew they were going to be worse when we started with the phase 2, because if you remember, they were not new. Even when we vaccinated the phase 1, the healthcare workers, as we participated on the Sisonke phase 3B clinical trial, those issues were raised. And then we planned. Our plans was to say the people of Limpopo have got their own community leaders that they've got so much trust and faith and belief in. Firstly, we knew that traditional healers have got a constituency that believe in them, than they will believe in their physicians or their medical doctors, Western medicine. We know most of our Black people consult in the traditional healers. That is why you saw even in our program, there was a day when we even spend and launch it, moving from one district to another, vaccinating our traditional healthcare practitioners before we even move to the phase 2. We also know that most of our people believe in faith-based organization. That is why one of the institutions that we met even before the phase 2 was our South African Council of Churches in the province. And in a different district, we met with forums of churches, church leaders, where they were able to talk and advocate. You need a third party to advocate, because if there is a pastor out there talking about 666, whatever G that they know, which we don't know, you need to find someone from their ranks to be able to talk the message that advocates for vaccination. Now, when we met, we know most of our people as a province, we host the biggest churches in the continent. We host our ZCC church and St. Agnes, which combined, they have got a following in a constituency and a membership of more than 20 million. And I must indicate to you that our two bishops have been very supportive since the beginning of the fight of this pandemic. And even now with our vaccination program, they've been very supportive to the province and to the country, even to SADC, because they know very well that their constituency, which are the members of the church, needs to be saved, their lives need to be preserved, and we need to prolong their lives through vaccination. So having those respected leaders, including the kings, the Bavenda King, Phophi Ramathuba, the Queen Mother, the regent of the Skukune, the Bapedi nation, we engage with them, and we even vaccinated her. And she went out to speak on behalf of her people. So when you have community leaders with credibility going out to speak on your behalf, you will be able to win this battle of those who are prophets of doom, who continue to lie, to the people. So that is how, as a province, we've been able to succeed, humbling ourselves, going down to our roots, knowing how we were raised. We are African children ourselves, respecting senior traditional leadership, respecting our bishops, respecting our churches. That's why you see the people of Limpopo agreeing to follow us when we make a call to say, come and be vaccinated. Then they will say, these are the correct people because they speak to our leaders. Therefore, they speak our language.
And MEC, on the ground, you have been quite active. I mean, we saw you last week visiting some of those malls then and shopping centers with some of the shop owners really, not being happy about some of the things that were unfolding there. But certainly when one looks at even the numbers then in Limpopo, we're seeing an addition of 867 new cases as of yesterday. How concerned are you about this third wave and the numbers that you are seeing as a province? And will we be seeing you do more of those visits to those malls?
You know, it's quite unfortunate and it's quite a sad story for us because as we were busy around the malls when we're talking to people, June 16 came. If you go and look at our numbers, you see that at that time we were very low. We're still ranging around 100 and something within 24 hours. Today, you are rightly saying we're at 867. Now, if you look at the virus and its incubation period, on June 16, we are on record as a province to say, we hear even political leaders going out on public to say they are going to defy these particular regulations. They will continue with gatherings. They will continue with having social gatherings. We saw in our province a number of, on June 16 day, I remember in Mogalakwena, Waterberg municipality, which is one of our epicenter, having a big social gathering, which we tried to condemn. We even called the police to say, can we go and arrest the organizers? Because if you look at from June 16 and when the numbers were very low, up to when on the specimens that we collected on the 21st of June, they came, which is 5 days post June 16. Those specimens, when the results came, they shoot from 290 within 24 hours to 724. So you can see those beds and Waterberg, where there were many of these gatherings, became a super spreader. What is the problem is that in the specimen that were taken on the 22nd, the results we are talking about of 867 is the specimens that were taken on the 22nd. I also went further to do an analysis in terms of the age group. For the specimen that were taken on the 21st, the age group is between 15 years and 39 years. Those were in majority. Now, the specimen that we took on the 23rd, which the results came, and the one that they've just come in now, which is 828 new cases in the past 24 hours, it then tells you it's cluster outbreaks of schools, wherein we were doing a tracing of those who were part of the June 16 who tested positive. When we traced in their school, we found there is a school today in Ibembe, Mashau, wherein we've got 18 learners testing positive. Is cluster outbreak. I don't want to repeat about what's happening in Capricorn. What is worse with the current results that I'm analyzing now, we then find addresses of adults who have tested positive, the elderly ones. When we trace them to those who we took their specimen on the 21st, meaning it's their children who went to those June 16 celebration. So to answer you, I'm very worried because the virus does not move. We will continue to repeat this stage. Our social gatherings, our failure to comply with wearing of masks, with what, while we are still waiting for the vaccine and we are excited by all those gatherings, we must remember that the people that we are hating so much, the people that get hurt, it's our parents at home who get infected. I'm talking now, the admission today has gone up to 132. That is a lot in Limpopo. We did not have that kind of admission in the past week. We are having it now because June 16 has been able to contribute social gatherings of that day. Science doesn't lie. The incubation period, those learners started to be symptomatic on the fifth day post June 16. So they couldn't, and the area that we see having these challenges is the area where we saw a number of social gatherings. So we will not rest. We will continue with our message. We'll continue to move to the malls. We'll continue to urge parents, help us, talk to your children, not to attend this social gathering. Embarrass the organizer of these political rallies. Don't attend them. If you do that, you will assist us in fighting this pandemic. We also want the vaccines. We're waiting for the vaccines. But in the meantime, let's try to protect the most vulnerable while we're trying as a province to get our senior citizens vaccinated. We're trying hard. But please, young people, don't infect them before that vaccine reaches them.
And as a final question, MEC, we're out of time. Very briefly, your direct response to the EFF's march today, because you keep talking about gatherings, and I'm going to ask you then, what did you think of that march to SAPRA offices today?
I'm not happy, irrespective of who organized a social gathering or a political gathering. It doesn't matter, especially if it's political parties, whether it's the ANC, which I belong to, whether we are supporting anyone in court. Being there in numbers, those young people who are attending won't even show the symptoms that they are infected while we are fighting to get the vaccine. But the manner in which we're fighting is the manner that is spreading the very same virus that we are trying to fight. So for me, it's a problem because people who we come home and infect, it's the innocent people. And the innocent people, when they get infected, they don't survive. It's very difficult to tell a granny that when your son comes back from a rally, don't hug her, don't talk to her, tell her to wear mask, tell her not to serve you food. It's not easy. So all we can do, let's find other ways of fighting our battles, but not use the gatherings. I've got a problem with the gatherings, irrespective of who is organizing that gathering, irrespective of the reasons behind the gatherings. We can find a way to raise our concerns. But for me, when the president says, let's stop the gatherings, he was doing it for the good of us as South Africans so that we can protect ourselves and protect our loved ones, especially the most vulnerable.
All right. Thank you so much for your time. Tonight, that was Limpopo Health MEC, Dr. Phophi Ramathuba.